Hello, my name is Bemister and I'm a respiratory therapist, and I just want to go over some of the points of suctioning a patient orally. I have two examples here of what they call rigid suction. One is the traditional Yonkar suction device, and the other one is the newer, the Decanto catheter, and they are for oral suctioning. And I just want to show you basically if you're using the Yonkar suction the traditional way, it would be obviously connected to suction. Some of them have a small hole here that you would cover with your finger to apply the suction. This one doesn't. The idea would be, with his mouth open, to push it into the back to where the molars end would be as far as you'd want to go, pretty much, because after you get that point, you're going to start to cause a gag. Now, in patients that you're suctioning, a lot of times it's because their level of consciousness is decreased. In that case, they probably won't let you do an oral suction, or if you're going to do it, a lot of times because their instinct is they don't like things in their mouth, they'll close their mouth, and in particular with the Yonkar suction, because it has a round end, when they close their mouth around it, they'll bite it and you won't be able to get it out of their mouth. So in cases where I think the patient is maybe not going to tolerate the oral suctioning, I'll use an oral pharyngeal airway just as a bite block. And if their mouth is open, you can obviously just put the airway in. If their mouth wasn't open, before I put the airway in, I would just pull down on the jaw, put the airway in, so that it's between the teeth, and then if they're biting down, they're going to bite on the airway as opposed to biting on the suction. And then you can go as deep as you want, pretty much. Just be cognizant of the fact that as you go deeper, touching the back of the tongue is going to cause them to gag, and you don't really want them to gag, so just use it as a way to test whether they have a gag reflex or not. And if they don't gag, then that would mean that they would be an ideal candidate to tolerate an oral pharyngeal airway, which I have another video on how to insert that. I just wanted to show you that with the Yonkar suction, the actual openings are very small, and a lot of times if there's any sort of debris in the vomit, if it's thick at all, a lot of times with the Yonkar suction it'll get clogged up and you have to take it out and kind of wipe it off and use it again and again. It's not ideal. The newer one, the Decanto suction, is actually quite a bit larger, and it's designed to remove a lot more material. And so when you were using, if I had the choice between the two, I would use the Decanto. And when you put it in, it's going to apply the suction continuously. And it's actually designed so that if there was a continuous flow of fluid in the mouth, you could actually place it in the back of the throat and just leave it in there, and it would just continuously suck that fluid out. It's particularly useful when you're doing an intubation to use this suction device.